It's important to know what all the potential complications are of a facelift surgery if you're considering going under the knife. I have a few videos on other complications, but today we're going to talk about injury to the facial nerve branches. The main branches of the facial nerve are the temporal, zygomatic, buccal, marginal mandibular, and cervical. All you need to know is that when you raise your forehead, when you squint really tight, when you puff your cheeks out, and then when you pull your lip down here, those are all muscles that are innervated by the facial nerve. During a deep plane facelift, we as surgeons are right above those nerve branches depending on what area we are in the face. The cheeks specifically, we're worried about buccal branches, and down in the lower jaw and neck region, we're worried about the marginal mandibular branch of the facial nerve. Now, I tell patients that nerves are very finicky. If they get bumped, bruised, or pissed off during the procedure, they're not going to work perfectly when you wake up. Permanent damage to the facial nerve is fairly rare during facelift procedures, but temporary weaknesses are commonly seen. Likely, it's just from the nerve and the nerve sheath being irritated since we were right around working on it. The good thing is that a lot of these nerve branches have the ability to regenerate or they have connections to other little branches, or anastomoses as we call it. So if one tiny little piece of the nerve gets injured, sometimes the neighbor will pick up the slack over the next few weeks and you won't have a noticeable difference in the way your facial muscles move. The most commonly injured branch of the facial nerve during face and neck lift is the marginal mandibular branch of the facial nerve. If you have a temporary weakness of this branch, when you smile, this lip won't pull down as far. You'll have a little bit of a crooked smile, like this. Most of the time, it will get better just with time.